The Many Faces of Gonorrhea, a public service announcement on a woman's perspective on the risks, treatment, and prevention of gonorrhea. Meet Maria. Maria is a 25-year-old college student that likes to hike and swim. 2 weeks ago, Maria met a really cute guy named Tom. Maria and Tom had sex. The next day, Maria had some concerns. How many girls has he been with? Should we have used a condom? Does he have an STD? Have you ever asked yourself one of these questions? Have you ever wondered if you were at risk for an STD like gonorrhea? Gonorrhea is a disease that is on the rise in the United States today. More than 700,000 new infections occur annually. According to the CDC, gonorrhea has increased by more than 18% over the last 10 years. Meet Jessica. Jessica is a 19-year-old who has just had sex for the first time. Jessica and her boyfriend used a condom during intercourse but had unprotected oral sex. Jessica now has gonorrhea. Jessica struggles to understand how she got gonorrhea if they used a condom during sex. Gonorrhea is a sexually transmitted disease you can get from having anal, vaginal, or oral sex with any infected partner. This means with each and every sexual encounter you have, you could be at risk for getting gonorrhea. Meet Jill. Jill has gonorrhea, but Jill doesn't have any symptoms at all. She doesn't even know she has gonorrhea. Jill has slept with multiple men in the last year without a condom. Jill even has plans with a new boyfriend this Friday night. However, not everyone with gonorrhea is asymptomatic like Jill. Some women can experience many different symptoms from the genital, rectal, and oral regions, including symptoms such as pelvic, abdominal, and vaginal pain, abnormal or increased vaginal discharge or bleeding, straining with bowel movements, bleeding from the rectum, anal itching, and purulent discharge from the anus, sore throat, drainage, white patches of the throat, painful swallowing, and swollen lymph nodes. Maggie is an 8-month-old baby girl. Life hasn't always been so happy-go-lucky for Maggie. When she was born, Maggie contracted gonorrhea from her mother. Despite precautionary measures taken during labor and delivery, Maggie contracted gonorrhea of the eyes. Gonorrhea of the eye can cause severe eye pain, sores, photosensitivity, purulent discharge from both eyes, and even blindness. Meet Cora. Her best friend has gonorrhea. Cora wants to know more about her risks for getting gonorrhea so she can help prevent it in the future. Cora's doctor told her that sexually active teens and young adults 15 to 24 years old are at increased risk of getting gonorrhea. She also heard that multiple sex partners, new or anonymous sexual contact, having non-monogamous sexual relationships, and having unprotected sex can place a woman at increased risk for getting gonorrhea. Cora also learned that preventing gonorrhea is directly related to its risk factors. In other words, to decrease the chances of getting gonorrhea, she must decrease the number of factors that put her at increased risk. Abstinence is the only absolute way to prevent gonorrhea. However, if Cora chooses to be sexually active, she can help protect herself by decreasing the number of sexual partners she has and using condoms consistently with each vaginal, anal, and oral encounter. Katrina went to her doctor when she was concerned she might have an STD. Her doctor told her that screening for gonorrhea is easy. A sample can be collected from a vaginal, oral, or anal swab, and even a urine specimen. He recommends that women less than 25 years old who are sexually active be screened annually. Those women who are 25 and older who are still sexually active and at increased risk should also be screened annually. Katrina's swab came back positive for gonorrhea. Treatment for Katrina will be easy. Antibiotics can be given to treat and cure gonorrhea. All partners should be treated to prevent reinfection or complications. If you think you are at increased risk for gonorrhea, talk to your healthcare provider about your risks, the prevention steps you can take to avoid sexually transmitted diseases.